and welcome to the Healthy Chicago podcast. My name is Joy Macatangay, and I'm a public health administrator at the Chicago Department of Public Health. Today, we're going to be talking about 2026 Open Enrollment. Our guest today is Morgan Winters, the director of Get Covered Illinois, where we'll talk about all things marketplace, what is Open Enrollment, who is eligible to enroll, what the timeline is, and more. Director Winters, would you like to take a chance to introduce yourself, explain your background, any information you'd like to share to the watchers, viewers?
I'm delighted to be here this morning, Joy. Thanks so much for having me on. I'm Morgan Winters. I'm director of Get Covered Illinois. I joined the team at GCI in March of 2024. Before that, I was the deputy director and chief operating officer of MNsure. MNsure is the state of Minnesota's version of Get Covered Illinois, the state-based marketplace in Minnesota. I was there for about a dozen years, had a number of different roles there, and I was part of the team that did the initial implementation way back in 2013 when states were first rolling out the Affordable Care Act marketplaces. So I have been living the marketplace life in the marketplace world for a fair amount of my career. It's something I'm very passionate about. And just so excited to be talking to you about the Affordable Care Act and Get Covered Illinois today.
Awesome. Well, thank you so much for being here. So excited to learn and hear about all of your experiences and how we can help ensure that as many Chicagoans get enrolled in healthcare as possible. And so I think a good general place to start is what is Get Covered Illinois?
Get Covered Illinois is the state's official health insurance marketplace. What that means is we're essentially a one-stop shop where Illinoisans can go get information about health insurance options, compare plans, get help when they need it. We have a full-service customer assistance center that folks can call or chat with. We also have a network of certified brokers and navigators. These are folks who are experts, who understand the plan options, how to qualify for subsidies, how to get people enrolled. You can find a list of those assisters on getcoveredillinois.gov. They are a great resource for really understanding all the options. Health insurance can be very complicated.
Of course.
And fundamentally, Get Covered Illinois is here to help, here to make it a legible process to get folks enrolled in coverage. It's also the only place where folks can qualify for the subsidies that make insurance coverage in Illinois and across the country more affordable. So getcoveredillinois.gov is the only place where folks can take advantage of those cost savings.
Awesome. Thank you so much. So one of the reasons that we're so grateful to have you on the show and to talk about open enrollment is just so people know that there is this resource. Get Covered Illinois is available for Chicagoans and all Illinoisans to get assistance to navigate the very complicated system of healthcare or health insurance in general. So on that note, we've talked about Get Covered Illinois. Let's talk about open enrollment. What is open enrollment and why is this an important time for individuals to and families to be aware of the dates that they need to enroll in health benefits?
Open enrollment is folks' opportunity to enroll in coverage without a qualifying life event. So this is a time where anybody who needs coverage can come to getcoveredillinois.gov and sign up for a health insurance or a dental insurance plan. Open enrollment runs from November 1st, so just a couple of weeks, to January 15th of next year. Folks who need coverage by January 1st need to act by December 15th. That's the deadline for signing up for coverage that begins on January 1st. Open enrollment is a great time to figure out what plans are available in your area. So depending on where you live in the state, you'll see different health insurance companies offering plans and different plans available to you. So here in Cook County in Chicago, we have tons of options. Folks will see hundreds of different plans to choose from. And starting on November 1st, they'll be able to sign up for those plans.
Awesome. I know the focus of this podcast is open enrollment, but do you maybe want to give a brief context for what special life events are or examples of what those are? That way people have kind of a distinction for the future of what maybe a time in the future that they could enroll.
So open enrollment is a time where folks can sign up for coverage between November 1st and January 15th. After that January 15th end of open enrollment, you can no longer sign up for coverage without what's called a qualifying life event. Now, a qualifying life event is something that triggers a special enrollment period. So open enrollment, special enrollment, two different
Yes.
animals. To qualify for a special enrollment period, folks have to experience a qualifying life event like losing job-based coverage. So in other words, if you're getting a plan through your employer and you decide to take a different job that doesn't offer health insurance, you can come to getcoveredillinois.gov and let us know about your change in circumstances that you lost your job-based coverage. There are lots of other qualifying life events: having a baby, adopting a child, getting married, moving either newly into Illinois or from one residential address to another residential address will oftentimes qualify folks for enrolling outside of the annual open enrollment period. Changes in income. So if somebody loses a job, has a decrease in income, that oftentimes will qualify them to enroll outside of the open enrollment period. Or if somebody gets a new job that offers them more income, that also can qualify them to enroll outside of open enrollment.
Awesome. Thank you. So part of the reason I wanted to have that distinction between a special enrollment period and what open enrollment is going on now or soon is that it's the lowest barrier for people to get enrolled in a health benefits plan. So we want to make sure that we catch as many people as possible before December 15th, if not January 15th, just so they're able to get connected to care with the least amount of barriers. Well, thank you for that. And kind of moving into more discussions about open enrollment and a lot of the information that is swirling through the atmosphere about open enrollment and Obamacare and subsidies. Could you help us understand what's happening right now and why it might feel a little different this year?
A lot is changing for 2026 in the health insurance sector. First of all, fundamentally and excitingly, we'll start with the really good news, is that Get Covered Illinois is opening as a state-based marketplace, which is why we're here. I do want to spend a little bit of time explaining what that looks like.
Please do.
So for the past 12, 13 years, Chicago residents, Illinois residents have used healthcare.gov to sign up for coverage during open enrollment every year. That's changing. So instead of going to healthcare.gov, folks are now going to go to getcoveredillinois.gov. And that is our own homegrown state-based marketplace. That's going to be a real improvement to the experience folks have had on healthcare.gov. So that is one of the really positive changes that's happening this year. Less positive, there are a lot of policy changes coming out of the Trump administration that's going to limit people's access to coverage and make it more expensive for enrollees. And it's important that we raise awareness about what those challenges are going to be, because they're going to be felt in pocketbooks across the state and certainly in Chicago.
Yeah.
The biggest change coming out of Washington is the enhanced premium tax credits, the enhanced subsidies that folks have been using since 2021 to make insurance even more affordable, are set to expire on December 31st of 2025. So I'm gonna wonk out here a little bit and give you some detail. What those subsidies are is in 2021, as part of the COVID response, the Biden administration and Congress beefed up the subsidies under the Affordable Care Act. So the Affordable Care Act has always had these premium tax credits that makes insurance more affordable. What the Biden administration did is they enhanced those tax credits. And they did that in three really important ways. The first part of this enhancement was that folks who are just over the income threshold for Medicaid, these are people that are between about 133% and 150% of the federal poverty line. Those folks could access either free or very, very low cost premiums through the marketplace. And by low cost, I mean $3 to $5 a month with these premium tax credits, these enhanced tax credits. The other thing that the enhancement did is it removed the upper limit for qualifying for these enhanced premium tax credits. So under a traditional Affordable Care Act structure, if you make over 400% of the federal poverty line, you can't qualify for tax credits. Under the enhancement under ARPA, that barrier was removed, and middle income folks making over 400% of the FPL could newly qualify. And then in the middle, between 150% and 400% FPL, it made the subsidies more rich and more generous, and so lowered costs for families in that income range as well. At the end of the year, if Congress does not act, and they still can, these enhanced subsidies could still be extended, and we're advocating here at Get Covered Illinois that Congress acts and does just that. But if they do go away, folks are going to see an increase in costs in 2026, and that is to the tune of about $130 per household. That's the statewide average. It's going to vary considerably depending on where folks live, but that's about a 50% increase in out-of-pocket costs if those enhanced subsidies go away. So it's really important that we're raising awareness about the impact and how important those subsidies are for Illinois families. Now, if the expiration goes forward, then folks are still going to be able to access subsidies. So it is not that they go away entirely, but they will be less rich, which means insurance will cost more in Illinois and across the country.
Got you. And so what we're looking at right now is we have more affordable health benefit plans currently based off of current policy. And what we're waiting for is for action from the federal government on those tax subsidies, and whatever decision is made there, they might increase. And so what we want people to be aware of is just like currently we're not sure what that's going to look like. And so there might be a bit of sticker shock for individuals when they go back to the marketplace and are trying to enroll in a plan that maybe costs a lot less or costs a lot more than it did last year. And so we do want people to be aware of that. We want them to know what their options are. Another great reason to get connected with Get Covered Illinois if you have any questions about pricing or just understanding the plans that are options for you. But thank you for that context and that background, because it's really important to know and be aware of as information is constantly changing and people are told a lot of different things and we don't always know what to believe. So it's helpful to have that information background. Thank you. And then kind of stepping forward, who is eligible for open enrollment and health insurance through Get Covered Illinois?
Yeah, so there are 3 qualifying factors to use Get Covered Illinois. You have to be a state of Illinois resident. You have to be residing in the United States with a legal status. In other words, you need to either be a citizen or a legally present immigrant, and you can't be incarcerated. So those are the only 3 qualifying factors to use the marketplace. The marketplace typically is for folks who don't have access to employer coverage, so self-employed people, gig workers, folks who own their own businesses, early retirees, folks who formerly had coverage through an employer but have retired and are still too young to access Medicare. Those folks oftentimes rely on the marketplace to get covered. To qualify for the subsidies that make insurance more affordable through Get Covered Illinois, that's based on a few factors. If you do not have access to affordable coverage through another source, you can be eligible for those tax credits. So if you're getting Medicare, if you're getting Medicaid, if you're getting an affordable plan through your employer, you won't qualify for those tax credits. The amount of tax credit that somebody will qualify for is based on their income and how much health insurance costs to them, depending on their age, where they live in the state, who's in their household. And so the idea of the tax credits is that depending on where you are income-wise, you will never pay more than X percent, and that percent changes depending on what your annual household income is.
Absolutely. Thank you. So generally, I feel like the long story short for the marketplace is that it catches a lot of people who may fall through the cracks in terms of the current health insurance options that exist. So people who maybe make too much for Medicaid, or maybe their employer doesn't offer an affordable health insurance plan. So it's a good option for people who may not have an affordable option right in front of them, or through the system as it exists. But thank you. We talked a little bit about special enrollment periods. Generally, what happens if someone misses open enrollment?
If you miss open enrollment, you still may have a chance to enroll in coverage through Get Covered Illinois. The first step is to go to getcoveredillinois.gov, and we will have a option to report a special enrollment period qualifying life event. And you can do that by just updating the application that you submitted during open enrollment, if you submitted one, or submitting a new application outside of open enrollment. And part of that application will just be telling us what's changed in your life. I've had a baby, I've gotten married, I've moved, I lost my employer plan. You can tell us all that right on the application, and we're able to determine your eligibility for a special enrollment period real time. So this is not a long process. This is something that you can do relatively quickly, and we have lots of options for help to help folks do that. You can call our contact center. We can walk you through the process. Also, I really like to recommend our certified navigators and certified brokers. These are folks who can really sit down with you and walk you through the entire application process. And if you've had something changing in your life, you've got a new job, you've got a new baby, you're dealing with other things in your life. We want to make this as easy as possible for folks, and that's where our assisters really come into play.
And the assisters can be found through your website, right?
That's right.
Yeah.
Getcoveredillinois.gov. We have a nice directory on there. That's right.
Awesome. And kind of our last question to wrap up, just to get a gauge of accessibility, what resources or supports are available for individuals who English might not be their first language?
Yes, that's a great question. We have been incredibly intentional on trying to make our website and all the services that we provide as accessible to as many Illinoisans as we possibly can. What that means is that we have a website that is fully translated into Spanish. This is not your web widget that does a poor
auto translation.
Exactly. That's not what we have. We have native Spanish speakers who sat down with all of our English content and translated it word for word into Spanish. And the goal there is to make the website as easy to understand for both English speakers and Spanish speakers. Now, of course, we've got lots of other languages spoken in Chicago and across the state, and we want to make sure that we're meeting those folks where they are as well. Our contact center has translation and interpretation services for about 250 different languages. So essentially, any language that's spoken in Illinois, we're able to have interpretation services over the phone or in chat so that folks can get help there. We're also making our notices, the letters that we send folks with information, available in both English and Spanish. And then if folks speak another language other than English and Spanish, we have services that can provide that information in a written form in whatever language they speak.
Awesome. Well, thank you so much, Director Winters. We really appreciate you taking the time to bring your expertise and knowledge to this space and to inform Chicagoans about how they could get connected to health benefits plans. Before we roll out, let's end with a fun question. What's your favorite fall tradition?
You know, Joy, this is going to alienate some of your listeners, so I'm going to apologize in advance.
Controversy.
Yeah, a little controversy. Spicing things up. My favorite fall tradition is watching my Minnesota Vikings play football.
There's the controversy.
Yep. I am a diehard Vikings fan, living here in Chicago, which I will make a plug for what an amazing city. I am so happy to be here. But nothing makes me happier than going to a game at Soldier Field and watching my Vikings take on the Bears.
Well, thank you again so much for taking the time to be here. Thank you for sharing. And we hope that you all are aware of the 2026 open enrollment now. Know that the time and dates for which you can get enrolled in a health benefits plan, December 15th, or at the very least, January 15th. And thank you so much again for being here.
Thanks for having me, Joy. It was a pleasure.
Thank you.